This module is an introduction to mindfulness that touches upon three of the many areas in nursing education that can be transformed by this practice: safety and compassionate, empathetic care for patient and caregiver alike. In this brief introduction, we will dip our toes in the water to explore the most basic understanding of mindfulness and how it might impact the lives of the future nurses we are educating. We will discuss the foundation of mindfulness, explore mindfulness research in attentional capacity as it may relate to patient safety, and explore mindfulness as both a means of self-care for the caregiver and as a doorway to empathy in patient care. For many, mindfulness has been introduced into the lexicon via the literature of mindfulness-based interventions, or MBIs. Mindfulness-based therapeutic modalities are growing by leaps and bounds and are widely seen as valuable interventions in areas of healthcare, education, and business. Just a few samples of these various modalities and references pertaining to their theoretical and psychological constructs are offered here. But no matter what the cause of suffering, the root approach is the same: paying attention on purpose in the present moment, non-judgmentally. Mindfulness-based stress reduction, the first intervention developed by John Kabat-Zinn at the University of Massachusetts Medical Center, is the most widely studied. It was initially introduced to those patients with chronic pain who found inadequate relief in traditional treatment modalities. MBSR quickly found applicability in all types of human suffering and struggling, with a few samples noted here. Through formal and informal practice, MBSR mobilizes the quality of mindfulness in order to investigate one's moment-to-moment experience. Because the filters of our perception, our appraisal, are often below the threshold of awareness, and because we are conditioned by history and habit, we often react in a knee-jerk fashion, as if our inner-outer environment is a threat, rather than stepping into a way of seeing that allows more possibilities for response. By paying attention non-judgmentally in the present moment, we open new ways of seeing that allow a healthier response to our environment. The MBSR format offers learning and refining of a range of self-regulatory skills aimed at increasing proprioceptive awareness, relaxation, and awareness of mind-body experiences. It provides didactic and experiential awareness of stress reactivity, emotions, thoughts, and coping skills in relationship to perceived symptoms. Zendel Siegel, Mark Williams, and John Teasdale adapted MBSR to integrate more of a cognitive behavioral approach and found mindfulness-based cognitive therapy allowed those with recurrent depression, defined as 3 or more episodes, to have significantly less relapse and suicidal ideation. Acceptance and commitment therapy is a manualized treatment approach developed by Stephen Hayes that also uses mindfulness in individual and group settings to target the suffering which arises in habitual cognitive processing. Dialectical behavior therapy, developed by Marcia Linehan, has a strong mindfulness component, and while originally geared towards the difficult-to-treat borderline personality population, is now more widely used. Jean Christeller at Indiana State University and Jeff Greason from Duke University bring the application of mindfulness to eating disorders, and although at present most data are around binge eating, there is encouraging emerging work regarding metabolic improvements in those with insulin resistance and diabetes. Alan Marlott and Steve Hickman have adapted MBSR to specifically support relapse prevention in addiction. While how these modalities are increasingly finding their way into the treatment armamentarium for clients suffering from various physical and psychological maladies, our interest in this presentation is connecting with how this may be germane in nursing education. Basic definitions of mindfulness all boil down to intentionally paying attention non-judgmentally in the present moment. Models developed by Scott Bishop and Jim Carmody to explore mindfulness with scientific rigor have described this as two components: self-regulated, intentional attention maintained on the present moment, and an attitude adopted towards one's experience that is characterized by curiosity, openness, and acceptance. In other words, it is non-judgmentally experiencing what is, without elaboration. This moment, after all, is all we really have to work with. For in fact, everything else but this moment is a thought about the past or the future. But despite the fact that this may be obvious when we think about it, we find that we need to bring intention to this paying attention, to pause in our current experiencing long enough to actually know the present moment. How many of you right now are attempting multitasking? Checking emails, thinking about all you have to do after this module, maybe work on a paper, a grant application, pick up dinner, or even just wondering how many more slides are there in this presentation. Once we have set an intention to pay attention, we might consider, what is attention? Attention is a limited resource which has three main components beautifully elucidated by Michael Posner and Amishi Jha. Alerting is the capacity to be receptive, at the ready, so to speak, ready to receive whatever information presents itself in the environment. Reorienting is needed when we are distracted. It allows us to quickly and intentionally shift attention back to its original intentional focus. Executive control is that function of attention that selectively attends to an intentional focus while actively inhibiting that which is irrelevant. It allows cognitive control to stay on target, setting goals and priorities when there is a multitude of conflicting data. Sounds a lot like life, doesn't it? We have always been whole and integrated beings, body, mind, and spirit. Mindfulness brings this inherent integration into our awareness. Mindfulness meditation is simply arriving in one's body and knowing it. It is the awareness that is not thinking, but that which is also aware of thinking. Mindfulness is non-judgmental and open-hearted. It is cultivated by paying attention on purpose, deeply, and without judgment to whatever arises in the present moment in our inner and outer experience. By intentionally practicing mindfulness, deliberately paying more careful moment-to-moment attention, individuals find that they live more fully and less on automatic pilot, thus being more present for their own lives. How might this capacity meet our lives in the field of nursing? As Pat Ebright from the Indiana University School of Nursing pointed out in her 2006 work, as knowledge workers, nurses apply unique, specialized clinical and psychosocial knowledge that supports independent and collaborative decision-making in the delivery of health care. A major obstacle to progress in patient safety and quality is the lack of appreciation of the complexity of this nursing work. As described, this complexity includes missing equipment or supplies, frequent interruptions, delay of systems or processes, inconsistencies in communication of patient care, time constraints, and the learning curve for myriad new or changing processes. Dr. Ebright describes a model of stacking as a dynamic process which depends on the ability of the nurse to be mindful and engage in accurate sense-making in the midst of unpredictable and constantly changing situations. Without mindful attention, we become lost in thoughts about stresses at home or the next patient we wish we could get to sooner. And before we know it, we're not here with the complex situation at hand. It doesn't matter how smart we are if we are not paying attention. Mindfulness allows us to be present, open, aware of our inner and outer landscape. It is a way to meet the complexity of our present moment experience. What causes nursing errors? No one sets out to make an error. We know that error reduction requires an understanding of human cognition and the limitations of human mental capacity. Looking but failing to see is common in all walks of life. These errors are not made because we're uncaring or unintelligent, but rather we're often on autopilot. So what has to change? Attention must correctly identify important information so that it's not filtered away by distracting thoughts and emotions. Safety professionals have long been interested in the issue of conspicuity, getting people to notice unexpected objects and events. It's often the more experienced of us that develop expectations and mental models that permit a sort of pre-programming of behavior in routine or frequently performed tasks. This then becomes autopilot, and we can miss what's right in front of us. Lack of clarity in communication occurs for the same reason. Mindfulness meets all these recognized factors. We all fall into habits of mind and body, of attention and inattention, which result in our not being present for our own lives. These habits are ruts in the road. The consequences of inattention can be quite costly. They can result in our making mistakes, in missing out on personal and relational experiences, and in our ignoring important information about our own health. Rut-in-the-road reactions to the stressful events of our lives can also become so habituated that they occur essentially outside of our awareness, until, because of physical or emotional or psychological dysfunction, we cannot ignore them any longer. An important antidote to this tendency to go on automatic pilot is to practice mindfulness. For as R.D. Laing has said, the range of what we think and do is limited by what we fail to notice. And because we fail to notice that we fail to notice, there's little we can do to change. Until we notice how failing to notice shapes our thoughts